You've been diagnosed with a cut or laceration and given some either stitches or some staples. Here's what you need to know and a bit of what you might like to know. So once you have the stitches in, you want to keep them dry for 24 to 48 hours. Same thing for staples. We don't use staples very often unless it's somewhere inside the scalp that the cut occurred. Everywhere else we generally use stitches in the emergency room. So keep both dry for 24 to 48 hours or 1 to 2 days. Once you get home and you've had 24 hours, take off the bandage and take a quick peek at the wound. Now, I expect it to be red around the wound a little bit because we've just sewn it up and it's had lots of injury to it, but we want to make sure the redness around it isn't growing and getting bigger. That means there's an infection there. So every day, once a day, take off the wound, the bandage rather, inspect the wound and see that it's not getting more and more red, that it's spreading around the wound. You can also take off a little bit of the excess scab while you're there and then apply polysporin once a day and put the bandage back on it. You can even apply the polysporin twice a day if you can remember, because that will help keep it moist and allow it to heal even faster. You don't have to buy the brand name polysporin, though you can use whatever generic the pharmacy has. They both work the same way. They have a little bit of antibiotic property to them, but really what helps is keeping the wound very moist. Again, checking on it once a day, making sure there's no increased redness, and put the polysporin on once to twice a day. Many people ask, well, should I keep it covered or should I let the air get to it? In fact, there was a study a few years ago which showed that it's slightly better to keep the wound covered, so it will heal maybe by a day or two faster if you keep the wound covered as opposed to letting the air get to it. So do keep it covered if you can. The stitches or staples should come out in 5 days approximately if it's your face, all the way up to 14 days if it's over your joint, like your elbow or your knee, something that moves, or over your wrist. Because every time you move that wrist, it's going to try and open up the wound, and if you don't have the stitches in there for a longer period of time, the wound isn't strong enough and it's going to pop open. But on your face, you don't want to keep them in for very long. So 5 days for your face, and get them taken out either with your family doctor or a walk-in clinic. You can also ask them to put some steri strips over it to increase the strength of the wound. These are some steri strips that I got from the pharmacy. You can buy these at a regular pharmacy, and they're just like little stickers that you apply over the wound once you've taken off the stitches, and it just gives it a bit of extra strength, because 5 days is a very short time to ask your skin to heal and to be strong. So those can go on afterward for a few days just to increase the strength. If the cut is over, say, your elbow, where it's opening up every time, it should be 14 days, or your wrist or your knee, wherever you can see that it's going to open. Otherwise, all other wounds should be about 8-9 days before you get the stitches out. If the wound starts to bleed at home, just cover it and apply pressure, good solid pressure, and I want you to set the alarm on your stove for 10 minutes and no less, and no peeking. Patients often come in saying it's bleeding, and they've got their hand over the wound, and every minute I can see they're in the room and they're peeking to see if it's stopped. That's why it's still bleeding. You need to hold it on there. And I know it seems like a long time, but if you set the timer, you will really do it for 10 minutes. And I guarantee that unless you're on warfarin, which is a very strong blood thinner, we call it rat poison, warfarin or Coumadin, everyone else should be stopping within 10 minutes. So hold your pressure on, it will stop, and then you won't have to come back to the emergency room and wait to be seen. If it's a very big cut on your arm or leg, try and keep the area elevated. So if it's on your arm, like I've been demonstrating, keep your arm up. You want to take away all the swelling as much as possible. Pretend you're the queen and you have your hand up as if you're about to wave at any moment to try and keep everything drained. If you have your arm dangling down, it's going to take longer to heal. When you're sitting down, if it's on your leg, put your foot up on a chair. When you're sleeping, put your leg up on a pillow or your arm on a pillow, just to try and get a little bit of drainage to help it heal even faster. Also, don't use the extremity quite as much as usual. Don't take up marathon running, the day or two after you've had a big cut on your leg, because it's going to take longer to heal if you're using it a lot. Lastly, reasons to come back to the emergency room is if you're developing worsening redness, like I mentioned earlier, around the wound, especially if it's streaking up the extremity. You see a red line coming up from the area. If you develop a new fever or you see pus coming out of the wound. Otherwise, you can also see your family doctor if you can see them within 24 to 48 hours, but otherwise come back to the emergency room for that. I'm Dr. Atzema, and those are my discharge instructions for a cut or laceration with stitches or staples.